This is Dr. David Albert at the Digital Health Summit at CES 2019, and it's my pleasure to have Sean Carney, the Chief Design Officer for Philips. And Sean, you know, you go around here at CES, around the digital health booths, and you see a lot of different designs. Tell me, what is the scope of your design mandate at Philips?
So I'm very fortunate at Philips in that I have the opportunity to work across the entire kind of health continuum, from consumer health, where we can start to look at behavioral change and driving healthier living, right through the diagnostics, getting in earlier, doing more precise diagnostics in the intervention space, and then across the entire care pathway and health continuum.
Well, you know, so obviously, whether it's from a Sonicare all the way to an MRI scanner, and as you mentioned to me, Philips helped design an entire cardiovascular hospital in China. That's a wide domain. What do you see as the trends when you're here at Consumer Electronics Show, you have a company like Philips that's focused on health across the continuum? What do you see as some of the design trends that you think are important?
Rather than just design, it's about you know, at CES you see a lot of technology trying to fix a lot of the problems that we see in the healthcare world at the moment. So, you know, the healthcare space is under enormous pressure, and people are getting sicker. The demands on the system are not going to get any easier over the course of the next 10 years. But the way we think about healthcare today has got some fundamental flaws that I think we need to address. So when it comes to thinking at the moment, we seem to be fixating around sick care. So fixing problems when we found them. And I think we have to switch more towards early detection or even prevention. And that will require more behavioral change in the population and engaging people in taking care of their health. And it's really nice to see a lot of startups, a lot of small companies now coming into that space. But I think having point solutions will not address the problem. We really have to think about how do we team up as ecosystem partners to really join the dots and think about a continuum where we move from sick care to more holistic healthcare regimes.
Well, you're right. I think the issue is, as a physician, my wife's a physician, my oldest son's a physician, you know, when they tell you it's not about the money, it's all about the money, you get paid for taking care of sick people. We don't get paid for preventing disease, especially chronic disease. So you're right, we need to figure out how to engage people, how to change behaviors, and design in a holistic fashion is part of that. So do you see any trends for Philips in terms of, obviously, company was involved in consumer electronics, kind of got out of most of it, and now is really focused on health. What do you see for Philips in terms of moving forward?
So I think the advantage that we've got right now is we have a great history of working with the consumer space. So some of the DNA of the company is really about understanding and being very intimate with the needs of the customer. Now translate that into a patient or to somebody experiencing or consuming healthcare. And that's a little bit of the holy grail for many of the people working in healthcare today, is how do we understand those consumer needs and that consumer demand so that we provide better, more relevant services and improve the patient experience. But what we know is that just fixing the patient experience alone will not necessarily result in better outcomes or reducing the costs. So we really have to include the caregivers, the radiologists, the physicians, the surgeons, and the nursing staff in the process of
the people who
developing.
cost all the money.
And if we do that, then actually they will help drive the change that we need to see in healthcare. And guess what? If you have more engaged patients, better experience for the clinicians, you will impact the cost of care and improve the outcomes as a result as well.
Well, I couldn't agree with you more. That's wonderful. Well, thank you very much. Again, Sean Carney, the Chief Design Officer for Philips. This has been Dr. David Albert at the Digital Health Summit at CES 2019, hosted by Living in Digital Times. Thank you.